As I'm traveling around the state, I'm beginning to see some newborn calves out there in the pasture. And with newborn calves, we sometimes will have a problem with neonatal diarrhea, or what we commonly refer to as calf scours. Now, calf scours can be influenced by the environment, lack of immunity by the calf, and also stress that's put on that calf. The causative agents for this, the pathogens involved, are usually bacterial, viral, or protozoal. And usually when we have these calves with diarrhea and we actually culture out those pathogens, it's usually more than one involved in the disease. Now, these pathogens are readily available in the environment because normal cattle and sick cattle will pass these in their fecal material. Clinical signs of this disease are going to be obviously a diarrhea. It's going to be usually yellow to grayish in color. The consistency of it will vary from a pudding-like to a profuse watery diarrhea. We're going to get some electrolyte imbalances with this. You're going to see acidosis, obviously dehydration. We'll have low blood sugar, and a lot of times we'll have a low body temperature. And these calves are usually just depressed, don't want to get up and nurse, just want to lay around. Treating these calves with diarrhea begins with replacing the fluids that they have lost. We can accomplish this either through oral solutions, or if the dehydration is severe enough, we're going to have to hook these calves up to an IV and get them fluids that way. We want to make sure and correct those electrolyte imbalances. Most of the fluids that we use are going to have sodium, potassium, which is lost in this illness. We have to correct that acidosis by giving them some type of buffering agent. We want to make sure we get some energy in these calves, usually in the form of glucose. And we want to provide these calves with some shelter if their body temperature is too low. As far as an antibiotic is concerned, you need to consult with your veterinarian on that, because he's going to know what's the best antibiotic to use in your condition. Also, anti-inflammatories can be used in this disease. That's an extra label use of those products, but there is some information out there that shows these calves that are treated with anti-inflammatories have better appetites, and the amount of time that are sick is reduced. But you will need to consult with your veterinarian on the use of those too. Preventing this disease is going to be revolved around making sure that those calves are in as clean of an environment as we possibly can get them. Make sure these calves get adequate amount of colostrum at birth. We can vaccinate the cows about 6 weeks before they calve. It may improve that colostrum. The other thing we can do, there are vaccines available to give these calves at birth that may help you prevent some of the organisms that cause this disease. I hope that you don't have to deal with this disease this spring, but if you do, be sure and contact your local veterinarian and get him involved in your treating of this disease. If you'll go to sunup.okstate.edu, we'll have some information at the website for you.